Hello, hello everyone. Is this audible? Hello everyone. Is this audible? Yes, I'm here to discuss monsoon awareness tips today. This is my first live video on YouTube. I don't know where to see the messages. कोई एक message कर दो. Can anyone just text a message so that I can see? Yes, all messages. Close. Hello, yeah. Hello, Sujata garu. Welcome. This is my first live video, so no, we don't expect so many people today. If you want to ask any doubts, please ask. AK, hi, hello. Dhara Mehta ji, hello. How are you? आज हम लोग today we are going to discuss some tips on upcoming monsoon, like tips for diarrhea, tips to avoid mosquitoes, mosquito bites, tips regarding what to do in dengue fever. That's it. So let me tell you regarding diarrhea. Since last few months, we have been fighting regarding a single topic that energy drinks, which act as ORS, like ORSL or rebalanced with ORS. They are not true ORS. They are just named as ORS so that people can be fooled into buying them. WHO recommended formula ORS is specifically made to be given during diarrhea, so that one sip of ORS along with water will go directly into the stomach and mixes in the bloodstream. Oh, thank you, Andy Sujata garu. ओआरएस का इम्पोर्टेंस ये है कि उसमें एक ग्लूकोज है, एक सोडियम है और एक क्लोरीन है. So once along with glucose, it enters into the bloodstream. Sodium will also go, so that water will also go. So एक सोडियम, एक ग्लूकोज और एक वाटर जब ब्लड में जाते हैं, उसके साथ क्लोरीन भी आ जाता है, तो बेबी विल बी हाइड्रेटेड. तो इसलिए when the baby is having diarrhea, loose motions, just give ORS, WHO ORS only. अगर टेट्रापैक में आपको WHO ORS मिल जाए तो इजी है. वैलेट का है टेट्रापैक, इलेक्ट्रॉल का है, और देयर इज वन मोर ब्रांड कॉल्ड राफ्ट. इसमें WHO ORS टेट्रापैक मिलेगा, यूजुअली ऑरेंज और एप्पल फ्लेवर में. ऑरेंज और एप्पल फ्लेवर अगर बेबी को अच्छा लगे तो यू कैन गिव, अदरवाइज प्लेन इलेक्ट्रॉल सैशेट भी मिलेगा. सैशेट 200 ml वाला 200 ml में मिक्स करो, एंड 1 लीटर वाला यू मिक्स इट इन वन लीटर सैशेट, एंड दिस कैन बी यूज फॉर एटलीस्ट 24 आवर्स. एक बार सैशेट मिलाएंगे तो यू कैन यूज इट फॉर 24 आवर्स. थैंक यू एके. इट्स अ वेरी रूटीन ट्रायल वीडियो. मैंने पहली बार इंस्टा पे यूट्यूब पे आया है. आई एम जस्ट चेकिंग इस पे लाइव कैसे बात करता है. So this season we are going to do lives on YouTube, um, to increase engagement, because YouTube पे usually I post videos and I don't chat much. So people are very angry on me. दो लोगों ने मैसेज किया क्यों वीडियो लगाते हो, कमेंट पे रिप्लाई नहीं देते हो. So I thought YouTube को भी we should consider YouTube people also and reply to them. And yeah, next topic. Yesterday, I posted one video regarding chicken pox. So in Hyderabad, we are in Hyderabad. My clinic is in Hyderabad. Kids are here and there getting chicken pox. कैसे आता है chicken pox? Usually there should be one patient who should be having chicken pox. तो उसको वो पानी वाले जो लीजन्स रहते हैं वाटर वेसिकुलर लीजन्स बोलते हैं इंग्लिश में. So 2 days before the vesicular lesion starts, child starts spreading chickenpox virus with cough, with sneezing, and with touch. If the child touches the lesion, some child isko lesions aa gaye. If the child touches the lesion, then also the chickenpox will spread. So usually, when the child is vaccinated with chickenpox, बहुत कम. So it will be very less. But if the child is not vaccinated, then the chickenpox is severe and this child has longer course also. And ये chickenpox 7 से 10 दिन में वो पानी वाले जो lesions है vesicular lesions will heal, but the low immunity period will be there for 1 month. So एक बार chickenpox आ गया, once the child gets chickenpox, that low immunity will stay for 1 month and they are prone for respiratory infections. खांसी ज्यादा आता है, cold ज्यादा आता है, and sometimes it changes into pneumonia also. 2.2 kgs birth weight, and by 1 year they should be 3 times the weight since birth. So your baby Pavani garu is 2.2. By 1 year baby has gained 7.5. So nearly 3.5 times the weight gain. So it's a good weight gain only. And how to increase weight gain is there are few tips. One, after 1 year you can start milk. That means animal milk can be started and it should not be diluted. Water galpaddu. Do not mix water in milk. Cow's milk is the best. Buffalo milk sometimes has lot of gas, lot of fat, and it may lead to gas. So what I advise is like 2 to 3 months time pay. Whoever has got gas, like baby who had gas and was suffering with colic, should not be given buffalo milk because it is very difficult on the baby to digest. So after 1 year, you go with cow milk, undiluted. Start with 50 ml. Maximum milk you can give along with breastfeeding is around 300 to 400 ml. So one is cow milk. It is the easiest way to give calories because 100 ग्राम खाना खाने से 40 कैलोरीज आता है. 100 ml दूध पीने से 67 to 70 कैलोरीज आता है. That means extra 30 calories with easiest way of is drinking milk. Okay, so adi milk okati. And the other thing is add fruit to every meal. Fruit has lot of fiber, and fiber when it goes into the stomach adds bulk. The baby's digestion is better, and the baby will feel more hungry every time. If you can eat egg, if your family is eating egg, you can start one egg every day. Egg white and egg yellow, both of them. Since this baby is 14 months, you can give egg white and also yellow once per day, 5 days a week. And 2 times in a week, you can give non-veg like chicken, mutton, or fish. So fish is the best form. At least 1 week को एक बार देना चाहिए if you're eating fish, because fish में ब्रेन डेवलपमेंट के लिए जो फैटी एसिड्स है वो है. सो 1 to 2 years में यू कैन गिव फिश. स्टार्ट विथ वेरी स्मॉल क्वांटिटीज उसमें. यस, श्रावणी गर्ल्स, लेट्स कंप्लीट पावनीस वन. सो स्पाइसी फूड से स्टार्ट करना चाहिए. या सो बाय 18 months, यूजुअली व्हाट वी एडवाइज इज by 9 months we should start family food. By 12 months you can start salt, and by 15 months whatever the family is eating you should start eating, the child should start eating. Like अब आप rice dal या vegetable curry करते हो, the same taste should be going to the baby, except if the baby feels spicy, add a drop of ghee. Because as long as we delay, जितना भी delay करते हैं spicy food देना, उतना baby will start rejecting spicy food. It should start very early. Ideally, I should say by 12 months, baby should be eating whatever we are eating with just a drop of ghee. So that is regarding spicy food. Start early so that it is acceptable for the baby. Other tips of weight gain is four soaked almonds or 4 walnuts. If the child is very Small cannot chew. You just powder them and mix it in the milk or food. That will also give lot of essential fatty acids which are helping in brain development. Suma KV, can I give MSET for 10-year-old child? See, the reason, let's discuss vomiting. Vomiting is also part of diarrhea. So the reason for vomiting is that the stomach has been affected with some infection or indigestion. So infection is, it could be food poisoning or it could be the water poisoning. So the stomach is angry now. So it wants to take rest and pushes everything out of the stomach. So if you give water, if you give food, it will come out. What I advise is take 1 hour break between every vomiting. If the child has vomited now, do not give anything for at least half an hour to 1 hour. If you don't give food for half an hour to 1 hour, the stomach will calm down. The vibrations in the stomach, which are causing the vomiting, will slow down. The peristaltic movements also will slow down. And then you should start with WHORS, 1 or 2 spoons of ORS, and then slowly increase upon it. Giving emetic does not help in the initial phase of vomiting. Only giving enough rest. If you give rest to the stomach will calm down and the child will start accepting food. So what the trick I advise to our parents is वॉमिटिंग हुआ तो आधा घंटा से 1 घंटा छोड़ दो बेबी को और उसके बाद ओआरएस एक एक चम्मच दे दो हर एक मिनट में एक चम्मच so that the baby will start getting hydrated. Once the baby has accepted around 10 spoons of ORS, that means consider stomach थोड़ा calm down हो गया, 2 चम्मच खाना देना चाहिए. आप ऐसा नहीं करो कि पूरा खाना दे दो जैसे दिन भर खाना खाते हैं, लाइक इतना खाना क्वांटिटी खाते हैं एक टाइम में तो उसमें से 10% देना चाहिए, खाली 2 स्पून से एक बार. So that is the trick to avoid vomitings and come the child to come out of vomitings easily. Most of the time parents make a mistake that as soon as the child vomits, they immediately give water or ORS or some buttermilk. Since the stomach is very angry, it will push out. It will push out the whole thing, and then we start panicking. We say, come to the doctor and tell them, whatever we give, he's vomiting, sir. I think he's going into dehydration. The main reason for dehydration is not waiting to further vomiting for the stomach to calm down. So give rest to the stomach, and you'll see that the child will come back. Am I audible? Can anyone say give a thumbs up? How is the audio? So other thing with MSET is MSET should be given ideally at home. If you are trying MSET, it should be given only after 2 years. Okay. So before 2 years, try not to give MSET. MSET has side effects and it might lead to a lot of cramping of the stomach and sometimes it increases the bowel movements and the child starts to have loose motions also because MSET stops the toxins which are in the stomach. Like आपने कुछ खाया, that is food poisoning. Okay, so there are some toxins in the stomach, some bacteria in the stomach which need to come out. Now, if you have given MSET, आपने MSET दे दिया, so the MSET stops the vomiting and the toxins which are there in the stomach, the bacteria which are there in the stomach will go down the intestine and it will lead to loose. So that is why other way of approaching vomiting is if the child is vomiting, as I told, give rest and do not give antiemetics. So antiemetics, first thing is delay the healing of the stomach. And the second thing is sometimes the infection goes down in the intestine because you have stopped the vomiting and child will have diarrhea, loose motion. So very careful. If you are at home and the child vomits, do not directly start NSAID. Okay. Um, nice. So this is my first live video. I hope the audio is better. Next video, I'll try to announce. I'll give some topics, like 4 or 5 topics. After the topics are done, I can discuss in the comment section if there are any comments or doubts. which can be discussed in general with general public, then I can discuss that. We'll give 2 minutes. If anyone has questions, just ask any question, I'll answer and we'll close it. So this is my first live video. So thank you all for attending. Whoever is there, thank you for coming live. Uh, YouTube follow, will be taking care of you. I'll be giving more number of replies to the comments. If anyone has any question, you just ask. We'll do 2 questions and I'll close this for today. Some mother asked about fever in the comments. So how to approach fever? If your child is less than 5 years, uh, you use a digital thermometer, put it in the underarm. So underarm के नीचे दोनों हाथ के नीचे ऐसे लगाना चाहिए. It should touch the skin. Skin को touch करके ऐसे close करो underarm को. Then wait for 1 minute. If the fever is above 99.5, you give paracetamol based on the weight. If the fever is below 99, you should not give treatment based on the assumption that hands are warm, legs are warm. एक बोलते हैं ना हाथ बहुत गर्म है, सर बहुत गर्म है. So based on this, you should not give treatment. Okay, do not give paracetamol unnecessarily. That will increase the pressure on the liver because paracetamol, how much ever you give, it goes to the liver. It has to be processed in the liver and sent out. So do not overuse paracetamol. अगर fever है, so it should be above 99.5. Paracetamol should be given every 4 to 6 hourly. Okay, after every 4 to 6 hours, you should repeat. How to monitor the temperature if the child gets fever? If it is above 99.5, wait for around half an hour to see if it goes on its own. But if it is increasing step by step, then you start paracetamol and monitor temperature every 2 hours. Only if the temperature is crossing 101, 102, then you start sponging with warm water. How to sponge? Face, front, back, then hands and legs. Usually we sponge the hands and legs and then start sponging the core. But ideally, what we need to reduce in fever is core temperature. So core temperature is face, front, back. Then we go to the hands and legs. ऐसे करने से core temperature जल्दी कम होता है and the child will come out of fever. And it should be warm water, not cold water. ओके, गर्म पानी से ही क्लीन करना है बॉडी को, ठंडे पानी से नहीं. ठंडे पानी से क्लीन करेंगे, मल्टीपल टाइम्स करेंगे, देन बेबी विल गेट कोल्ड, बेबी को सर्दी हो जाएगा. ठीक है. Ibugesic and Meftal are very optional drugs. Usually, why we give Ibugesic or why we give mefenamic acid? So that the temperature will come down faster. Ideally, I prefer ibugesic because it is safe. Mefenamic acid, what happens is, जब भी डेंगू है, नहीं तो अगर बेबी को ब्लीडिंग डिसऑर्डर है, नहीं तो बेबी का स्टमक कुछ इन्फेक्शन है, तो मेफेनेमिक एसिड देने से ब्लीडिंग होता है स्टमक में. That is why we usually don't prefer mefenamic acid. And one more important thing is mefenamic acid should not be given for children with febrile seizures because mefenamic acid itself will induce febrile seizures. So never give mefenamic acid in febrile seizures. So that is it fever and temperature. अगर 100 है 100.5 है, आपको कुछ भी नहीं करना है, वेट करना है. वेट फॉर द टेम्परेचर to be there because अगर fever है then only child will improve faster because body increases our body increases temperature to get healed faster so that the bacteria or virus in the body will die because high temperatures रहने से body में bacteria और virus multiply नहीं होंगे. It is not a good environment with them. That is why our body will heal faster. So that is why do not try to bring down the temperature below 99.5. Keep it around 100, 100.5 so that the child will heal faster. Okay, that is for today. Thank you. This is my first live video. So everybody, whoever came to the live, thank you very much. We'll meet next time. I'll announce the live video next time and then we can all meet and discuss properly. Thank you all.